So let's talk about vitamin D3. And vitamin D, as each of you heard in our initial talk, is more than just a bone hormone. We think of vitamin D as being just keeping our bones strong, but let's look at what it really does. If you have inadequate vitamin D, your HDL, your garbage trucks, are going to be fewer in number just because you don't have enough vitamin D. You remember us talking about the cells that line all the arteries, the thousands of miles of arteries, and that's what regulates the health of the artery. Those cells don't work properly if you are low in vitamin D, and that way plaque grows faster. If you are on a statin drug, which a lot of people that are on cholesterol medicines are on statin drugs, you're more likely to have muscle problems if your vitamin D level is low. And then just the health risk. If your level is below 15, and in our practice, when we measure it routinely, about 20% of the folks are below 15. Ideal is in the 30s. 60% of our folks that we measure are low, maybe not down to 15. But if you're below 15, 78% more stroke risk, 45% more heart disease, 77% higher mortality rate. This is a big deal. This is a big deal. So where can we get it? Well, here's some of your choices. You know, you could eat 6.5 pounds of the mushrooms or 150 egg yolks and all sorts of things that are vitamin D fortified, and indeed they are. But what were you saying?
Marlene's eating the salmon.
That would be every day that you'd have to do this.
You have to eat that much? Would you have to eat all of that
No.
combined, or just take one?
One of those. One of those. Or we could go to the bottom one, 10 minutes. Yeah, 10 minutes of sunshine. Now that's a challenge though, if you have a job. I mean, if you're working in the office, I mean, this time of year especially, you get to work, sun ain't up yet, and you go home, the sun's already down. And the weekend, you can't really say, well, I'll do 70 minutes on the weekend. That doesn't quite do it. But sunshine's important. So other possibilities in our approach is that because everybody we measure, virtually everybody is deficient and runs in the 20s, what we recommend is to get you up into the high 30s, that you take 2,000 units of vitamin D3 every day. 2,000 units. It comes in lots of different strengths out there, so you have to look at your bottle. And we would encourage you to ask your doctor to measure your vitamin D level the next time you have blood work. Now, you may have to pay out of pocket for that. It's really not that expensive of a test, and I think it's worth that expense.